Hi, everyone. We'll let the lobby fill up a little bit, and then we'll get started in just a minute. But happy to have you all here. Welcome to our kickoff event for Nursing Week and the launch of our nursing club. So more to come in just a moment. Okay, I think we'll just jump right in as people are joining. But hello, everyone. My name is Jason Mannion. I am the Director of Community here at Tallo. I'm so excited to have everyone here today. We have our esteemed guest. We have Sherry, or should I say Dr. Wilson, who will be helping to co-host today, and she'll be introducing our guests. And so I just wanted to start out with an overview of Nursing Week, this event where we'll be hosting throughout this week to celebrate nurses everywhere, as well as the launch of our nursing club. So really the catalyst behind us really getting behind Nursing Week and starting our own nursing club at Tallo is that at Tallo, we have over 1.7 million members total. And of those members, nursing is the #1 in-demand career for both career pathways and education pathways on our platform. That accounts for over 170,000 members that are specifically interested in nursing as a profession. And so we looked at that and we said we have to really serve you better by creating more content, bringing more opportunities to this amazing nursing population that we have. And so that was the start of Nursing Club. We are launching it this week, today, actually. And so we'll get into that in a little bit, but we decided what better time to launch the Nursing Club than in alignment with National Nurses Week, where we're celebrating nurses. Why don't we launch our nursing club and just double down on that? So really quickly, I'm just going to show you where the nursing club lives, and then we'll get into some of our guest speakers. So if you're a member of Tallo, you may already be familiar with the Tallo community. If you haven't yet joined Tallo, we have our Tallo community where we connect our members with each other, but also with companies, colleges, professional organizations like HOSA, who's here today joining us. So lots of great ways to network, to create content. And again, because we have such an incredible nursing population, we created the Nursing Club. So if you just navigate to categories, you'll see it's the newest featured category. And once you navigate to the Nursing Club, you'll see a lot of different ways that you can get involved. So this is the RSVP for the event that you're currently in. You can also sign up here for the Nursing Club, and that'll get you all of our emails about Ask Me Everythings with industry professionals, scholarships, internships, jobs, all things that are aimed specifically for nurses. If you sign up here, we'll get those opportunities straight to your inbox. And then if you scroll down a little further, you'll see some of the activities and events that we'll be doing as part of Nursing Week this week. So we're hosting Ask Me Everythings with industry professionals in nursing. You'll meet one of them later on in the event, Anna, who is not only a nurse, but a TikTok influencer. So she's leveraged it in some really creative ways. And so she's going to be hosting an Ask Me Everything as well. And then you can also see we're hosting a Future of Nursing Scholarship. So if you click here, you can learn all about how to be eligible for that and how you can get started in the nursing club. So I'll stop there because we want to get into our amazing guests as well, but we're excited to have you all here and we hope that you join us on the nursing club. So with that, I'll pass it over to Dr. Wilson.
Thank you, Jason. As Jason mentioned, I'm Dr. Sherry Wilson with Tallo, and as a registered nurse, I just want to express how excited I am to see so many of you interested in the field of nursing. And as a member of this community in the nursing club, You are the next generation of nurses, and we are going to help you to get there. National Nurses Week is a very special time for nurses because it's an opportunity for the world to celebrate and recognize nurses for their contributions to the profession. And so we're going to provide some additional information for you about the history of Nurses Week and Nurses Month in the chat. So this evening, I welcome you to the next generation of nurses. It's a week-long event, as Jason mentioned, and we hope this week will inspire and motivate you. And to support students going into nursing, we are pleased to sponsor a $1,000 scholarship. And I see some of you have already started that process, and we're so excited. And so we have some more information for you again on the scholarship in the chat. Tonight, I have the honor of introducing some special colleagues who will share their inspirational stories and insight into the profession. But before I introduce our first speaker, on behalf of Tallo and our general manager, Ross Woodley, and all of us here at Tallo, I want to thank my nursing colleagues for all that you do. Happy Nurses Week. So everyone, please enjoy the program. Moving into our introductions, I'm honored to introduce our first speaker, Mr. Marcus Henderson, who's the national chairman of HOSA Inc. Board of Directors, the parent organization of HOSA-Future Health Professionals. Mr. Henderson is a passionate and dynamic speaker and leader focusing on the future of nursing to include education, practice, and leadership, mental health, diversity, equity, inclusion, and anti-racism in nursing. Mr. Henderson holds various leadership roles at the local, state, and national levels. Mr. Henderson received a BSN, which is a Bachelor of Science in Nursing, and an MSN, a Master of Science in Nursing in Health Leadership from the University of Pennsylvania School of Nursing. And he also holds a certificate in healthcare innovation from the Perelman School of Medicine. So without further ado, Marcus Henderson.
Well, thank you so much, Dr. Wilson, for that introduction. And thank you so much to you and your colleagues at Tallo for the opportunity to represent HOSA Future Health Professionals and speak to you a little bit this evening about my journey and career in nursing and talk a little bit more about HOSA Future Health Professionals. But like Dr. Wilson, I would first like to start off with a very happy Nurses Week and Nurses Month to my nursing colleagues that are joining us this evening, and also to our future nurse colleagues that are on this call. And again, thank you to Tallo for the opportunity to partner on this event to celebrate nurses, to celebrate our profession, and to really explain why and showcase that our profession is valuable, it's rewarding, and it's a special career path as a health profession. So a little bit about myself, and as I tell my personal story, it's inextricably linked with HOSA, Future Health Professionals. And for those of you that aren't familiar with HOSA, it's an international organization with over 260,000 members from across the world, from the middle school, high school, and post-secondary collegiate levels who are interested in health careers. That's not just nursing, that's nursing, physicians, physical therapy, occupational therapy, all of the health professions that you can think of fall under the umbrella of our organization. And we're linked with career and technical education and health science and biomedical science programs across the nation. So for me, that's how my journey started. As a high school, well, first, as a 12-year-old, I was the primary caregiver for my great-grandmother and great-aunt, who are both homebound, and I provided personal care for them. So at 12 years old, you can imagine doing bed baths and clothing changes and medication administration, and you name it, I was doing it. So from a very young age, I knew I wanted to be in healthcare. But it wasn't until I saw the power and experience and just the sheer commitment to maintaining the dignity and respect of my family members' lives that was epitomized by the nurses, the home care nurses, the ER nurses, the long-term care nurses. No matter what setting we were in, we interacted with nurses. And when I entered high school, I chose to attend a high school in Philadelphia that had a career and technical education program focused on building future health professionals. And that's where I was mentored by a registered nurse to then choose that as a career path. And while there, I joined HOSA as a high school student. And HOSA is a stellar organization, and our core values really are focused on leadership, service, learning, and innovation. And as a member of HOSA, you're able to experience things like conferences, workshops, our competitive events program that truly highlights the academic and technical skills that you learn in your educational programs. So it's really an adjunct and complements your learning in high school to truly make you the best candidate for nursing school upon graduation. Because you're not only learning the skills of anatomy, physiology, pharmacology, all of these core sciences in your high school programs, but HOSA really provides you with critical leadership and professional development opportunities. And I wouldn't be the person, nurse, or leader that I am today hadn't it been for my involvement in HOSA as a high school student, being involved as an active alumnus and serving and mentoring students, much like yourselves, to this day, because I understood the value and power of HOSA to change lives. Personally, I'm a first-generation college student from a low-income family, and HOSA provided me with the opportunity to travel across the country, to meet people from across the world that I would never have had the opportunity hadn't it been for my membership and the support and mentorship of my local chapter advisor, who was a registered nurse. So that's just a little bit about HOSA, and then more about who I am and why nursing is important to me. When I graduated nursing school, I founded and launched a community health worker program working with homeless individuals in Philadelphia. And I talked earlier about the core values of HOSA and innovation being one of them. And it was really some of those creative ideas and bold thinking that I was exposed to as a HOSA member that led to me developing this program with a colleague in Philadelphia. And from there, I then became passionate about children and adolescents' mental health. As you can imagine, working with a homeless population, many of them have unaddressed mental health needs. And when you talk to them, a lot of these things started out when they were children. And in adolescence. So it drove me to really begin thinking about how do we address and care for young people who are experiencing mental health challenges. So I practiced in an inpatient setting for about 3 years, caring for young people and working with their families to address some of their needs. And that, led me, and you'll notice a theme here. And if you become a nurse, you're constantly, we talk about lifelong learning and the opportunities to build yourself, not only getting a bachelor's, master's, or what have you, but also just the sheer vast of specialties that you can expose yourself to. And you begin asking questions. And a lot of my questions were, why do we care for children and families in this way? Why do we do it this way? Why do I keep seeing the same children be readmitted time after time? And again, isn't the care we provide supposed to prevent them from coming back and seeing us in the hospital? And these questions led me to get to pursue a PhD at the Johns Hopkins University School of Nursing, focused on the critical role of parents, specifically in adolescent suicide prevention. But I say all this, my career journey in community public health to mental health nursing, to really say that, the nursing profession is your oyster. You can really do anything, whether that's providing direct clinical care, whether that's being a researcher like myself, whether that's being elected and serving in your local, state, or federal government. When we think about, Representative Lauren Underwood from Illinois, who is a nurse that is serving in Congress. So you can be a policymaker. You can be a lawyer. The opportunities are endless should you choose a career path in nursing. And, oftentimes, especially as students, and probably some of my nurse colleagues here can agree, you're going through your education program at any level and you say, oh my gosh, why am I here? Nursing's hard. This educational experience is challenging and difficult. But I think many of us can agree that when we say, I think I want to do something else, and I ask the question, well, what would I do? And there's nothing else I would ever choose to do than to be a nurse and to care for others. So, thank you again to Tallo for hosting the event, launching a nursing club where young people can come together to talk about nursing, to learn about everything that our rewarding profession has to offer, because it's connections like these that showcase the true excellence, leadership, and innovation that is capable, that nurses are capable of. So thank you again for the opportunity to be here and speak a little bit about my journey, and encourage all students here to look up HOSA, www.hosa.org, and see if you have a local chapter near you in your biomedical science program or your health science program, to ensure that you're exposed to the endless opportunities that HOSA has just to make you, a better, more well-rounded student and future nurse. So thank you.
Marcus, thank you so much for your leadership and your commitment, and all of your contributions to nursing. And as Marcus mentioned, the world is your oyster as a nurse. There are so many opportunities, so many things that you can do, and you will see that as we progress through the program and hear from different guests. Thank you so much, Marcus. And we have provided the link to HOSA in the chat for all of you. Thank you. I'd like to introduce to you our next guest, Anna Pascarella. She is a passionate and dedicated registered nurse, and she specializes in obstetrics with over 10 years of experience with direct patient care. She helps manage the care of pregnant, laboring, and postpartum patients. In addition, she cares for newborns, both healthy ones and ones that need some medical assistance. She is committed and enthusiastic about educating patients, nursing students, and the public about obstetrical nursing and care. She utilizes several social media platforms to share her professional knowledge and experience. This evening, I welcome Anna Pascarella. Anna?
Hi, everyone, and thank you so much for that introduction. I want to say Happy Nurses Week to everyone, and I'm so glad you guys are here. Again, you are the future generation of nursing, so this is such a great opportunity to learn and experience and see the good aspects of nursing, which I find that if you're in nursing school right now, maybe you can see some negativity, especially through social media, but in reality, nursing, like Marcus said, has so many opportunities, and the world is truly your oyster. So I'm just going to talk a little bit about myself, how I became a labor and delivery nurse, and some suggestions to those who are interested in the obstetric field. So when I was younger, I was in a women's health clinic. I am also a first-generation college graduate, and I didn't have the support, the parental support that I wish I would have had at home. So I went to a women's health clinic to get some stuff done. And I just remember the nurse being younger. She might have been a nurse practitioner, medical assistant. I just pictured her as a nurse. She was so open and honest. She didn't make me feel judged. And I remember that was the first time in my life that I felt respected by an adult and someone was actually listening to me. So that sparked my interest in women's health. So fast forward, I went to community college because I wanted to save money and took my prerequisites. And then I transferred to a university, Chico State, to get my bachelor's. And I knew I wanted to do something in women's health, but I didn't necessarily know what that would look like. So I learned through my clinical experience, labor and delivery was definitely the place for me. There was no doubt in my mind. And I feel that nursing school is a good foundation to let you know maybe like what you don't want versus what you want. And through that experience, I just knew that labor and delivery was where I wanted to go. And I heard a lot of people say, you should start in med surg. I hear it all the time. And I get that question asked all the time. Should I start in med surg before I specialize? And my honest answer is, I don't think so, because that is where I started over 10 years ago, and that's where I still am, and I've loved it ever since. So I want to talk about, how do you become a labor and delivery nurse? So the minimum requirement is to have your license, so pass the NCLEX. You go through nursing school, you take your NCLEX, and honestly, guys, you can apply to any labor and delivery job. Some hospitals might require a bachelor's degree, but a lot don't require that. I work with a lot of nurses who have their ADN, their associates, and a couple things that I always tell nursing students, if they really want to get into labor and delivery, is do an internship if you can. And I remember going through my internship, like paying to work. And I'm like, this is crazy, but I will do whatever it takes to get into labor and delivery. So that, I honestly think that gave me more experience in the labor and delivery field than nursing school, sitting in class, even my clinicals, because when you're partnered up with an actual nurse for a month, you get so much experience that you wouldn't allow like that. And that definitely plumped up my resume, is taking a fetal monitor. You just pay for the course, and once you take it, it really gives you the foundation of fetal monitoring, which is a huge thing in labor and delivery. You need to learn how to read fetal monitors, and then also get your NRP, neonatal resuscitation program. That is something that's also going to look good, and every nurse on a labor and delivery unit needs to know how to do that. So you can sign up at a hospital, or you can go online and find a class to take it. So I've talked about the feelings of going into a specialty. Is going into med-surg bad? No, not at all. I think it's such a good foundation. And oftentimes that's where people do have to start to kind of get like their foot in the door to try to get into a labor and delivery unit. And also you learn so much doing a med-surg. That's typically where a lot of people start if they want, and then they want to advance. But some people obviously stay in med-surg. But what I was saying is that just getting your foot in the door and talking to a manager will really help you get into labor and delivery. So let's go back to nursing school, how, there are certain foundations where when you're in nursing school, you kind of learn what you want to do and maybe what you don't want to do. And I just remember thinking that, oh my gosh, how am I going to be a nurse? When I graduated, I'm sure you nurses out here are like, how am I going to be able to take care of a person? How am I able to push those meds? Like, you are no longer the nurse, you're the nursing student, you are the nurse, and people look to you. And I just want to say that is absolutely a normal feeling. Like, I didn't feel like I knew how to be a nurse when I graduated nursing school. I think it's just a foundation of, sprinkling information in your brain and how to pass the NCLEX. I get that question asked by students all the time, like I don't know how to be a nurse. That's just absolutely normal. And you're going to learn through your education, or your on the job training. So when I got hired, the training to become a labor and delivery nurse was between 4 and 6 months. It just depends on how many births come in, how you feel personally. And it took me 4 months. And I remember that very first day I was on my own. My preceptor, she was wonderful. You guys have to remember that you are not alone. You're not alone. You have other nurses with you that will help support you. So it's about 4 months of training. And some people don't know this, but there are hospitals that specialize in labor and delivery and have units, labor and delivery and a postpartum unit. So those are typically bigger hospitals. Smaller hospitals have something called an LDRP, labor, delivery, recovery, and postpartum unit. So as the nurse, you have the role of all those nurses, and what's nice is that you can keep continuity of care. Let's say you labored a patient today, and then tomorrow, maybe you can request to go to postpartum and be with them because they know you built a relationship. And I have worked in an LDRP for the last 10 years, and that's my experience. And I really love to be able to do both. And honestly, what I love about labor and delivery is that every day is different. There's no monotony. Every experience is different. And of course, you are in a situation where you are taking care of people in one of their most vulnerable moments. Child is very vulnerable, and a new start. I went for 7 years before I had my own. It was kind of like a good birth control, but once I became a mother and went through that experience, I felt a much more deeper connection with my patients, and made me love the career even more, and also made me realize, people may not remember your name, but they're always going to remember how you made them feel. So I feel like if you want to go into the area of labor and delivery, yes, you definitely have to have the skill sets, but you also have to remember you're in one of the most important days of someone's life. So you also have to have a good personality to mesh with that field. But I find that most people who get into labor and delivery will retire in labor and delivery because it's such a fun place to be, especially in the hospital. There's a lot of death and trauma. I'm not saying labor and delivery, there's none of that, but overall, it's the happy place to be. And you really I look forward to going to work every day, knowing that I am truly going to make a difference in someone's life, and they're going to bring their baby into this world. And a good nurse can either make or break that experience. And obviously, I always want to make that experience for them. So thank you so much, Tallo, for having me. I am going to do an Ask Me Anything this Thursday. If you guys have any questions, I'll add a link on my socials, and I would love to answer some of your questions.
Anna, thank you so much. Thank you so much for joining us and for sharing your story, sharing your journey in women's health. I too am a former labor and delivery nurse, and I can say that everything you just shared was true. I also want to emphasize what you said about it's how you make someone feel. People may not remember, your name, but in nursing, it's how you make them feel. I think that is so important. Again, everyone, I want to remind you of Anna's Ask Me Everything, which is on May 11th at 6 p.m. Thank you so much, Anna.
Thank you so much.
Our third guest for this evening is Casey Green. Casey has been a critical care nurse for 8 years, working in adult and pediatric ICUs, emergency departments, and as a critical care ground transport nurse. Casey is also a nursing clinical instructor, paramedic, and volunteer firefighter. She is certified across multiple critical care specialties and is passionate about nursing education, supporting nurses both entering the profession and at the bedside and patient care. Without further ado, I present to you Casey Green. Casey?
Hello. Hi, everybody. I'm sorry in advance if you hear my cat. My cat chose just right now to start meowing downstairs. So I'm so grateful to be here. It's so exciting. I always love events where there's pre-nursing students or people that are they're not sure if nursing is the path for them or just healthcare in general. So a little bit about me. First off, happy Nurses Week. I love Nurses Week. I love being a nurse. I've been a critical care nurse for 8 years. I just passed the 8th year, and now I'm going into my 9th year as a nurse. Um, a lot of times people get lost on what does critical care mean. Basically, critical care is one specialty of nursing that encompasses a lot of different areas in nursing. So for me, currently I'm an assistant nurse manager in the intensive care unit, but there's all kinds of different ICUs that you can look at. Emergency department is considered critical care nursing as well. Same with cath lab, interventional radiology, PACU nursing, which is the nursing care after somebody receives surgery. And there's also ambulatory surgery centers where those nurses are considered critical care nurses. Also, there is transport nursing. So for me, when I was thinking about nursing as a career, I really liked the emergencies. I liked all of the high intensity, the chaos, the drama, the trauma, all of those things. I found that when there was any kind of issue or had anything with a patient, instead of running away, I found myself running towards that situation. And that's how I knew that it was for me. But I also had a competing love for EMS. So while I love being there when people came into the hospital and I knew that nursing was the journey for me, I had told myself if I passed boards the first time that I was going to become an EMT. I never wanted to be a firefighter, was not something I even wanted to do. And then once I became an EMT, after going to nursing school, I joined a local fire department. They paid for my EMT schooling. So I did it through the fire department. And then they asked me, do I want to become a firefighter? And I said, no. And then they asked me again, and I said, maybe. So I went through my firefighting classes as well. And then also took Fire 1, Fire 2, and added to that journey as well. So the thing that was nice about it is I got to take care of patients from the street when they called 911, but also taking care of them when they were in the emergency department all the way through their intensive care unit care, which is really big. You see people at different stages of an injury, and you really do get that bedside care no matter what area you're working in with them. So if you're interested in critical care, that's the first thing that I would say is there's so many different avenues. It's not just the ED, it's not just the ICU. You can do a variable of things. For me, that journey turned into after I was a nurse, I'd worked in the emergency department, and I knew that transport was going to be something I was interested in. So I went to paramedic school because in some states you become a paramedic and then you work as a transport nurse under both of those disciplines. So while I was at my clinical, and this is my second thing, is always be ready to network with anyone. Even if you're not in nursing yet, always be ready to network. Always know who your audience might be, because it might seem like you're just talking to somebody at the grocery store, but that leads to an opportunity. So when I was doing my paramedic school rotations, I actually was talking to them and I said, oh, well, when I have more experience, I would really be delighted to have an experience as a transport nurse here. And the manager said, well, why not now? And I was like, I don't have enough experience. But she said, you do. And doing your clinical through paramedic school, we can put you onto our nurse truck. You can see what it's like. And then from there, go forward if you're interested in this. So for me, it was very nice to have that experience, to then be able to step into that role. And it's nice for me being a critical care ground transport nurse. If you don't know what that is, basically for our patients, we take them between hospitals. Sometimes you're at scenes. You can do flight or ground nursing. So ground is in an ambulance. Flight is either in a helicopter or like a normal size aircraft, like that you would take to go on trips, like a 737. So with those experiences, I was able to do that. If you're looking at my jacket and you're like, there's so many things on that jacket, I have a lot of certifications in nursing. Education has become a passion of mine. And really, honestly, like critical care in all of its forms have become a passion. So if it's something that you're interested in, meet people, you can always reach out to me on LinkedIn. If you have a LinkedIn or on socials, I go by Critical Care Casey. You can always reach out. You always have a friend in me. Critical care is probably one of the most difficult nursing specialties because you see people at their worst. But if you're up for the challenge for that and really getting beautiful moments with patients, being able to put a small smile on someone's face when they're having the worst day of their life, and being able to take the moment and give them the dignity when it's being stripped away from them in every second, is really the best part about critical care. And being the person that when no one else can be with them, a lot of times their family can't even be with them, or they can't speak, or they can't breathe on their own, you're there, and they know that you're there. And they may never meet you, they may never actually speak to you, but they always know that they're there. So if you're ever interested in critical care, that's kind of the journey. For my EMS journey, you can do that before nursing, you can do it after. I did it the backwards way. Most people start with EMS and then they go into nursing. But for me, I did it backwards. I did nursing school first, and then I went on the EMS journey. But there's always local firehouses that you can join. And for me, it's another hobby and another way to give back to the community which I live in and the community that I grew up in, because I'm a volunteer firefighter with both companies. And as a paramedic, just being able to see healthcare from a different dynamic than I work in. And really, my big tip from the educator side is just use your resources. You're never alone. There's never a time where you are on your own on this journey through nursing. You're never on your own through nursing school. You always have people that support your journey. We're 4.2 million strong, and we would love to have you in our profession. And there's always people. We do not weed out in this profession. We elevate, we support. And if that ever becomes a problem for you, there are people there that can support you. So don't ever think that your journey is over because of one misstep here or there. I couldn't afford college. I am a second generation college student, first generation. After my bachelor's, I'm currently in a master's program and pursuing CRNA, which is nurse anesthesia. And I am the first person in my family to ever go on past a bachelor's degree. So, and my mom's the only person in my family who has a bachelor's degree. So it's definitely a journey, but you're not alone. I haven't ever been alone on my journey. There's plenty of people that want to help you and that believe in your journey. So don't ever think that you're alone on the pathway, and don't give up, because we need you. We always need nurses, but we specifically need all of you that are attending. If you're thinking about nursing, don't even give it a second thought. You belong here. We love you, and we need you at the bedside with us. Thank you, and happy Nurses Week.
Casey, thank you so much. Thank you for sharing your journey in the critical care space and providing tips for a community on how to navigate critical care if that's something that they're interested in. I want to pause before I introduce our next guest, because there were so many pearls of wisdom that were just dropped, within the last 20 minutes or so. And we had Marcus Henderson from HOSA, who talked about his journey as a first generation college student, his leadership journey, and his journey in research and community health, mental health, health equity, the health equity space. We have Anna, who talked about her journey in labor and delivery as a labor and delivery nurse. And you'll hear more from Anna a little later on this week. And then Casey, again, through her journey in critical care. A few pearls of wisdom that I've heard thus far. Be ready to network. You never know, who you might meet, what space you could be in, and I think that's so important. And you are not alone. You heard that from Marcus. You heard it from Anna. You heard it from Casey. You are not alone. You are part of a community, and others around you in your school and in your own support system So there are so many resources within nursing to help you to get to where you want to be. So I just wanted to pause and say thank you to my colleagues for those beautiful words of inspiration. And I want to now turn to our final guest, Lene Enochson. And Lene is a senior career development consultant at Sanford Health. Lene is a master's prepared educator with over 20 years experience in healthcare settings. As a career development consultant for Sanford, Lene creates, deploys, and evaluates healthcare occupation programming for K through 12 students. Without further ado, I'd like to introduce Lene Enochson. Lene?
Well, good evening, everyone. Let me know if you're having any difficulty hearing me, because sometimes my bandwidth isn't the greatest, but I want to say how grateful I am to be here in this esteemed group of people and to be here probably as in the presenters as the lone non-nurse. So I am a nurse fan. I have been working with nurses, well, of almost 20 years of my career. So I began teaching, not teaching, but supporting nurses at the University of Minnesota School of Nursing. So I was in records and enrollment management, I was in admissions, and then I moved on to the School of Public Health and ultimately to the School of Medicine. So I completed about 7 years at the University of Minnesota and then transitioned over to the state of North Dakota and worked at a standalone hospital in Bismarck, where I did support roles, but ended up in education. So while I am not a nurse, I have worked around nurses for a very long time. And there's something I'd like to say about if you're thinking about nursing, and I've been on the edge of nursing for my entire career. And there have been numerous times that I've thought, if something happened where I wasn't doing what I'm passionate about with education, I would go back and become a nurse. And I'm at the point in my life where probably I might not do that, but what I can say is there has never been a part of what I do that I couldn't do while being a nurse. So I could be an educator, I could be a mom, I could be an artist, I could be a senior career development consultant and be a nurse. I could do K-12 education in healthcare and be a nurse. But there's so many things that I've wanted to do that I could not do because I was not a nurse. So if that's on your heart to become a nurse, go for it. It is probably the best 1, 2, or 4 years that you're going to spend, because we know that nursing starts at all of those levels in terms of education. And what I'm here to tell you about tonight is why it makes a difference that you choose nursing and why it makes a difference that you choose an organization that has some really significant characteristics to it. So it's really important that people continue to choose nursing, because nursing is the heart of our medical system. There is literally no part of what we do at Sanford Health that can happen without the presence of a nurse. So, we may think of the provider being at the top, right? Those nurse practitioners, physician assistants, physicians, CRNAs, but truthfully, without the nurse, none of what needs to happen for patient care would occur. So that's why we see such a high drive for nurses and why we're striving tonight to keep you interested in being a nurse, in becoming a nurse. And where you decide to practice is important. So there's never been a time like right now to decide to become a nurse. Pretty much every organization, Sanford Health included, is helping people to go to school to become nurses. So it might be through tuition reimbursement once you've finished with school, or it could even be something like a sponsorship where an organization like Sanford or any other health system might say, we're going to pay to send you to school. If you sign with us, we will put you through school. And sometimes It's scholarships or sponsorships that are not tied to employment. So if it's on your heart to go to nursing school, I would suggest that you might be able to find a way to completely fund your education, whether that's through state grants, federal grants, or whether it's through an employer-based program such as Sanford Health might offer. Some other things to consider as you're moving into your nursing journey is taking a look at the safety environment of the organization that you want to practice with. So a lot of health organizations are becoming highly reliable organizations or safe organizations. So they might have an initiative that, of course, we put patient safety first, but we might have things that are put in place to make sure that your patients stay safe and you stay safe as an employee. That's important to consider. Now, we are going to be offering an educational session next Tuesday during the day, and there'll be more information about this on the Tallo website. I also have a QR code if we need to put that up, but we would love to have you join our Zoom. We'll be talking about nursing career pathways. We'll be talking about safe organizations, and we're going to be talking about a really cool incentive that's present at many health organizations, and that's a nurse residency. So I'm not sure what percentage of organizations offer a nurse residency, but you've probably heard about like doctor residencies or physician residencies. But we feel so strongly about bringing new nurses into our care environments of care with a great preparation that we have all new nurses go through a nurse residency program that's a year long and helps you acclimate into the environment of work after you've been in your training period. Now, we also offer nurse internships that happen during nurse education, so while you're in nursing school. But these are some of the cool things we're going to be talking about next Tuesday during the day. We will record the session, so if you register for our Sanford session, we will also send you that link out there. And yes, of course, my colleague who has a very similar last name to me. So she's an Enoxen, I'm an Enoxen, but there's a one letter difference. So Anna actually went through our MEDEX program. So she's a former MEDEX scholar, and that's a high school program where you can learn on-site, hands-on about healthcare programs. She went through that program and decided to become a critical care nurse for Sanford. So we're so proud to have her do it Ask Me Everything, and that will be on the 12th of May. So I've got just a couple more minutes left. Dr. Wilson, do you have any questions for me?
I just want to say thank you, Lene, for all of the resources that you just shared in such a short period of time. I think that it is so important to connect our future nurses with resources. And so I want to thank you for that. And I also want to remind everyone, we just dropped in the chat Lene's session, which is next Friday, May 12th, on her Ask Me Everything. And she'll be able to provide more information about nurse residencies, nurse internships, and opportunities with Sanford Health, who is one of our partners. So Lene, thank you so much.
Thanks for the opportunity, and we're looking forward to seeing you next week.
Perfect. And I see we have some questions that have come through, and our guests are diligently answering those. And yes, we can share the contact information for our speakers. We can send that out. At this point, I'm going to turn it over to my colleague, Jason Mannion, for any final words. I want to say Happy Nurses Week, Happy Nurses Month to my colleagues here on this call and all of our colleagues listening. And I'll turn it over to Jason.
Thank you, Dr. Wilson. And thank you so much to all of our speakers again. I thought that was perfect the way that worked out, getting to hear so many different nursing stories, different pathways, and then to have Lene close it out with some opportunities and ways that you can hit the ground running to get your career in education started in nursing. So it's almost like we planned it that way. But thank you so much again for everyone who attended today. And we wanted to close out with one of the ways that you can start getting involved with Tallo's Nursing Club. And so I'll share my screen again, but once you land on the Nursing Club homepage in the Tallo community, if you scroll down, there's two ways to get to the scholarship. We have it here, and then a little further down, we have it here. But you can click on the scholarship and you'll see the way that you can apply. If you're already a Tallo member, you've already completed step one, which is to join. If you are not yet a Tallo member, you can just click here to join. It's a really simple process. And then the next step is to create a post. We really want to hear from you and your aspirations and your goals and what inspired you to get into nursing and pursue that in the first place. And so all you'll need to do is take these prompts and you'll click to start your own post. And you can add photos, you can add video, you can type to your heart's content, but we really want to hear your story. So you respond to those prompts in your own voice and just tell us more about what got you into nursing and what interests you. And then you'll just tag it under Future of Nursing. And once you post, you're entered into the scholarship. And we'll be reviewing those scholarship entries, and at the end of next week, we'll be announcing the winner of the scholarship. So it could be you. And you can see some of your other nursing club members and their stories as well. So if you scroll further down, you can see all these wonderful Ask Me Everythings that we'll be doing with some of the colleagues of the speakers you saw here today. If you're excited about HOSA, we have Salil, Anna from the Sanford team, as Lene mentioned, will be later this week. So tons of great Ask Me Everythings. And then you'll see down here, these are the scholarship entries of other nursing club members. You can hear their story, get connected with them. This isn't just about connecting with companies and colleges and professional organizations. It's also connecting with other nurses, just like you, students and young professionals across the country. So you can see some of their stories, get inspired, and we'll have lots more ways to get involved with Nursing Club now that it's launched throughout the rest of the year. So keep an eye out, but we're so happy to have you as this kickoff event and the start of Nursing Club as a part of Nursing Week. So thank you one more time to Dr. Sherry for helping to co-host this, and to all of our amazing speakers. And thank you to our audience for tuning in. We're excited to see more of you in the Nursing Club. So thank you.
Thanks, everyone. Good night.